Can anal fissures cause rectal bleeding? Imagine feeling a sudden sharp pain when you go to the bathroom, followed by some bright red blood on the toilet paper or in the bowl. That could be a sign of an anal fissure. An anal fissure is a small tear or crack in the lining of the anal canal. It often happens after passing a hard or large stool, straining during bowel movements, or if you have diarrhea for a long time. These tears can cause bleeding and intense pain, especially during or after a bowel movement. The blood from an anal fissure is usually bright red because it comes from the small tear in the delicate lining. The bleeding tends to be minor but can happen repeatedly if the fissure does not heal. The pain can be quite severe and episodic, which makes it different from other causes of rectal bleeding like hemorrhoids. Hemorrhoids might bleed but often do not cause as much pain. While anal fissures are a common and usually harmless cause of rectal bleeding, it is important to remember that any bleeding from the rectum should be checked by a healthcare professional. This is because rectal bleeding can also be a sign of more serious conditions such as colon polyps, colon cancer, or inflammatory bowel disease. These conditions requiring proper diagnosis and treatment. In terms of colon health, recognizing the cause of rectal bleeding is key. If you notice bright red blood after a bowel movement, it might be an anal fissure, but persistent or unexplained bleeding should always be evaluated. Doctors may perform examinations like a visual inspection or a colonoscopy to determine the exact cause. To sum up, anal fissures can cause rectal bleeding by tearing the lining of the anal canal. The bleeding is usually bright red and accompanied by sharp pain. They are common and treatable, but any ongoing bleeding needs medical attention to rule out more serious issues. Maintaining colon health involves paying attention to symptoms like rectal bleeding and following recommended screening guidelines for colorectal health. Always consult a healthcare professional if you experience rectal bleeding to ensure you get the right diagnosis and care.